You're watching Street Smart. I'm Julie Hyman.
And I'm Scarlett Fu. We're just 30 minutes from the closing bell. We're here with our co-host for the hour, Glen Tullman. Glen is known as a pioneer in the healthcare IT industry. He is currently the managing partner of 7 Wire Ventures, which invests in companies that deliver healthcare information through the phone or the computer. You know, Glen, when we talk about healthcare in the country today, it gets so blown up with the politics of the situation, with Republicans and other critics saying that the government is taking over healthcare. But I know that you contend consumers are really the ones taking over healthcare.
Yeah, I think what we're seeing is it's just the opposite of what most people have said. It's a consumer takeover of healthcare, because if you think about it today, consumers are getting 3 things they've never had before. They're getting information on cost and quality. They're getting to make choices that they never did. And last but not least, they're being handed money in many cases by either the government or by their employers to say, you make the decision. And the way our economy has worked is when you put things in the hands of consumers, they generally make better decisions than any other entities. And if you look at the parts of healthcare today where consumers are driving decisions, there's a higher degree of satisfaction and there's lower cost.
What parts?
Well, as an example, for people who've had LASIK surgery, you know, perfect example. The costs have come down. And were you satisfied?
Life is great. I wake up in the morning, I can see what time it is.
Well, there you go. So, you know, that's the case. There's plenty of people who are having all kinds of other surgery, and they're saying for convenience, for special services, they'll pay additional dollars because they want choice, they want access. So we think of it as an intelligent, connected health consumer, not a patient. Nobody wants to be a patient, but it's about being a consumer and being treated that way.
But do you still end up with sort of a two-tiered health system? Because obviously not everyone, even if they have some level of coverage, can get LASIK or can get some of the other elective types of procedures. So even with this additional care that the Affordable Care Act has provided, does that really sort of close the gap?
Well, I think it's all a question of degree. So clearly, more people are entitled to more benefits than ever before. And allowing the market to manage that is going to be the most successful outcome, we believe. Again, more of it's going to, we're seeing not only government changes, but we're also seeing technology changes. So things like mobile access will become more and more important. Things like passive monitoring, so you wear a device, whether it be a Fitbit or whether it be some other device, that starts to tell you not just how many steps you're taking, but what's going on in your body.
Something else I've been really interested in is how you bring health costs down and increase the effectiveness of healthcare by doing more research, by figuring out what works. And what's astonishing is how little of that has been done historically. I know there are some healthcare systems now that are actually saying, you know, what procedures are being done, how effective are they, at what percentage, what are the costs. And it's sort of astonishing that this is not something, especially in this data-driven age, that hadn't been done more widely.
It's a little more common sense, and you wonder why that hasn't been integrated into the institution of healthcare itself. My point here that I'm concerned about as we turn this into a more consumer-driven healthcare is that you waste a lot of time doing research. I mean, I'm all for looking up all this information myself, but you waste a lot of time, and what you want is for someone to do it for you and to give you the data,
the results. What works.
Exactly, rather than dig up hours and hours of research to come to the conclusion that you probably would have come to anyway.
So one of our new services called Zest Healthcare is all about putting all the information that you would need as a mom, as a dad, or just as a health consumer on a phone. And that includes a care concierge to say, here's where you should go for this ailment, here's the best cost, here's the best quality. Because if you think about it, what other place in our economy don't we know what the quality is? Can you imagine going to the Gap and not knowing what particular pair of pants that you were going to buy cost? Somebody said, we'll get back to you later. It's unthinkable, and yet that's what we have in healthcare, and that's what we need to change.
Well, there are sort of services that exist out there where you grade doctors, right? I mean, but none of them is that widely adopted. I mean, you envision sort of a Yelp for doctors, where you could look it up and see what patients are saying. And those, again, those services do exist, but none of them is the household name quite that, as you say, you rate everything.
And that's what's happening.
Everything.
We're at the very beginning. A lot of people thought electronic health records, where I spent the last 15 years trying to get doctors to use electronic health records and electronic prescriptions, and they thought that was the end. In fact, that was just the beginning of having access. If you remember getting your first computer, it didn't do very much. But then all the apps, now you couldn't live without it. And then the computer moved to a cell phone.
And those doctors were initially pretty resistant as well to the technologizing of healthcare records. How do you convince that group to become less resistant, to start embracing the changes?
Well, I think doctors are very, very intelligent people, and they use technology in every aspect of their life. So do they want that access to information? They're also health consumers as well. And so giving them access to information real time is what everybody wants in healthcare. So imagine a phone that would allow you to not only talk to somebody real time, but schedule an appointment, see what your copay was, see what your deductible was, all of that information. That's what we'll have in the near future, and we really see it coming. And that change is driving every day. You mentioned organizations that are already rating doctors. That's the first step. But you also want to know if you're getting heart surgery, where's the best place in the country to go? This is a lot of money.
How can you not already find this stuff out? That's what's so astonishing to me. I wouldn't know how. I mean,
because it's in someone's interest not to.
Do I Google it? I mean, I wouldn't even know.
Well, and that's the problem. Googling it today, you just don't know where the information is coming from. So I think
right. The hospital tells me they're the best ones to get the heart surgery.
Exactly. Well, and every hospital wants to do that. The two most important things that we do, healthcare and education, are the two that have benefited the least from technology and that have the least ability to be an open system. And all that's changing now. So we're seeing it happening in healthcare and also in education.
You know, speaking of healthcare, I'm looking at the movers in the Dow Jones Industrial Average, 30 stocks and only one is higher, and that would be Pfizer. There was a preliminary positive results from a study concerning a drug that fought advanced breast cancer, but otherwise, 29 members of the Dow are falling this morning.